Everybody, good morning. Thanks for joining us for September's monthly coordinator webinar. This training is intended for you leaders to help hopefully give you some valuable skills, teach you some ideas that other leaders are doing around the state, and spark that, that engagement idea, an award. Sometimes the award for Aura comes out around November. Of course, we don't know what's going to happen this time around, but God willing that you guys will have that opportunity for funding. It's always great to listen to other leaders to get some ideas. So um, first up, thank you so much to our speakers. We have Katiana Rodriguez. She is the Emergency Response Coordinator for Stevenson County Health Department, which we also call Northwest Illinois MRC. And she has 10 years of healthcare experience and over 5 years in public health. She holds an MPH from George Washington University and is currently pursuing her RN at Highland Community College, yay, with plans to graduate in May 2026. She's passionate about community health and emergency preparedness, and Katiana aims to become a public health nurse and continue serving through the Medical Reserve Corps. Fantastic. I am turning it over to you, Katiana.
Thank you, Jeanette, and welcome everyone. I'm gonna bring up my presentation real quick. We practiced this earlier, so hopefully we'll have no problems. Can everybody see it?
Yes, ma'am.
Okay, awesome. So thank you for that presentation. Again, like Jeanette said, I am the Northwest Illinois MRC unit leader, and today I'm going to talk to you about how we got our STRONG grants and what we did with them. So I wanted to give you a little introduction. So the Northwest Illinois MRC actually started in about 2008, but we became decertified, sadly, during COVID when we didn't use our volunteers. But thankfully, we got recertified in 2021 when we had somebody new fill the position. And so we've been trying to just build after that. But there's been a lot of turnover. So I've kind of put it on my shoulders to rebuild the MRC unit, and I was really grateful for the STRONG grants to help me with that rebuilding. So with our MRC unit, it's a little unique because we serve 2 counties, because we actually, both Stevenson and Carroll County share an administrator. So they figured it probably is best to also share the counties for the MRC unit. And so that's what we do. Our total population is about 60,000 people, and I'm happy to say that we have about 35 volunteers. I became the unit leader. Like I said, there's been a lot of turnover, but I became the unit leader in December of 23. So I also wanted to share our mission. I'm just going to read it real quick. In active partnership with the community, the Northwest Illinois MRC improves the well-being and safety of all residents by organizing and utilizing public health, medical, and other volunteers. The mission of the Northwest Illinois MRC is in line with the mission of Stevenson County Health Department and the National Medical Reserve Corps. So after reading this and being a new unit leader, I was like, this is pretty generic, right? Like, where does this actually take us? So I wanted to do an assessment with some community partners. I did have an old volunteer that's been with the MRC for a long, long time. And so he was able to let me know what we had done in the past, but I really wanted to talk with the partners and see what are the gaps in our community and what can MRC do about that. So I did a listening session with our local emergency planning committee and unified command, and there was 3 big gaps that they saw in our community. The first one was training. We used to have American Red Cross actually have a center in our community, but that was over, I think, 10 years ago, and nobody's kind of stepped up and filled that gap since they left. So training has been kind of non-existent. We do have a local community hospital that has some trainers in it, but they're not always consistent with the trainings they provide, and it doesn't always get to the needs of what the people have. Another gap is collaboration. So we still do have a co-ed, but they haven't met in a while. And it used to be really, really strong. And now once one of the leaders stepped down, again, sadly, nobody stepped up and tried to take that over. So the collaboration amongst all the partners is something that needs to be addressed in our community. So that was something that they could see the MRC unit being kind of that connection point for all the partners and kind of boosting the collaboration between all of us. And then lastly, exercises. Again, COVID kind of put that to the wayside. And again, nobody's really picked that up. So we're hoping we can all collaborate together and do exercises and work as a team. But for the STRONG grants, I really wanted to focus on that collaboration piece because I feel like when I talked about MRC, a lot of people didn't know what it was in our community or that we were even here or available. And so I wanted to use the STRONG grant money to really boost our public-private partnerships and our relationships within the community and just let them know, hey, we're here and we're willing to work and willing to help out. So a big part of that was being able to do outreach and being able to do training. So a lot of our budget went towards getting all the supplies that are needed for the outreach and the trainings. Outreach was a big thing for me. I wanted to be able to do more events with people. And I think for us, meeting the people where they were. So driving to different locations, having events in different locations was really important. And we were allowed to do that with some of the new materials that we got. Also, I think having in-person meetings were more successful because we had that one-on-one connection and relationship with the people. And I definitely found that to be very successful. Again, making sure we had materials to provide the community training. So we got Stop the Bleed kits. We got new CPR equipment, which I was super excited about because when I went to go look at our CPR equipment, it was like inflatables. And I was like, oh no, how old is that? But so I was really excited to get some of those materials so we could do that and offer that for our communities. And then with that, we were able to include new partners to the table. And I was really excited about this too, because as we were doing outreach events, instead of us going out and trying to get people to work with us, the word got around and people started calling us for events, which I was super excited about. And so we were able to schedule some of those. And the community were just like grateful because they were like, oh, we didn't know this was a service. And we're really happy that you could come to us and work with us. And then just being consistent with our messaging and having good communication applies to bolstering this public-private communication or partnerships. So some project highlights. These are the new partners that we worked with during the STRONG grants. So Honeywell is kind of like a manufacturing business in town, and we were able to do a Stop the Bleed training with them and their engineers. Then we also worked with the Freeport Park District, and I can't remember which unit did the tick kits, but and had great success. But I was like, you know what, that's a great idea. So we also did tick kits, and we did it at a event that the Freeport Park District does every year at the Bunny Trail, and we gave it out, and that was very, very successful. So thank you to the unit. Sorry, I can't remember your name, who suggested that. We worked with the Farm Bureau, St. James Church, United Way, Northwest Illinois YMCA, and then Highland Community College Women in Science and Nursing Program. One good thing about doing these outreach events and trainings or community events was we got 6 new volunteers. I was so excited about that. And also volunteers of all ages too. So I was really excited to see that once we get the word out and we let the people know that we're here, that they are wanting to come and help out and volunteer their time. So I was really excited to see that. And it was also interesting because it was a lot of American Red Cross volunteers that have been lost for the last couple of years, and like we have this training from before and we want to use it, we want to help out. So that was also really cool. So we did do one Stop the Bleed training. We were scheduled for another one, but we had to push that off. And then we did 10 CPR trainings. Majority of them were for the health department staff, but we did set a couple aside for volunteers and community members. And then we continued with the Narcan trainings and our outreach events. So the big community events that we participated in during the grants were the Bunny Trail, farmers markets, both in Stevenson and Carroll County, because we wanted to meet both needs. You Are the Help Until Help Arrives, Yankee Doodle Bash, and the Lincoln Douglas 5K. So I was really happy. Actually, when Jeanette reached out to me to like, hey, can you do a synopsis of what you did during these strong grants? I wrote it all down and I was like, wow, did we actually do all of this? Like, that's crazy and fantastic that we were able and to get the opportunity to do all this too. And I know the volunteers really appreciated because we didn't have too many events before. And so it really brought back some of the volunteers into the organization and trying to keep them, keep the retention of them. So some of the challenges that we faced. First one, I would say, we don't really have like a marketing team. So when we were trying to do our own events, it was kind of challenging to put the word out and let people know that we were doing things and we would love for them to participate. So it was a lot more successful when we did events with established event or community partners. So like that Bunny Trail, they do every year with the park district, and we were able to add on to that. So we had a lot of success with that. So I'm hoping as we continue to grow our partners, we'll be able to get our name out there with the different events. Also finding time that works for everyone. I think that was really challenging and has continued to be challenging for all of the volunteers to find a time that works best for them. And that will probably be a continued challenge, but we'll hopefully adapt and get to all the events that we can. Locations, because we want to meet the needs of the people and reduce that transportation barrier and trying to kind of meet them where they're at. Some of the locations where we've done events or trainings aren't set up to what we need it to be. So that was a challenge, trying to adapt and figure out how are we going to do this training and make it the most successful it can be. And I think we're learning that as we go and how to be prepared for next time. And then also a big thing that I want to work on is reaching other populations. We do have a Spanish population. It's not very big, but nonetheless, I feel like they need to be included in more stuff, and I plan on working on that in the future. Okay, and now sustainability. So because a lot of our grant went towards getting the equipment and supplies needed to rebuild our name and our unit and offer services to the community, I think our sustainability looks pretty good because now we have the materials needed to do those trainings, to do the outreach events. And so I wanted to actually talk about an event that we just had for World First Aid Day. It was the first time we had done this. And we went out and did stations at the Freeport Public Library. And we had 5 stations: bleeding control, how to anaphylaxis, so how to use an EpiPen, Narcan training, choking, what to do if somebody's choking, and then also splinting and slinging. And as you can see in the picture to the left, Rick is the old-time volunteer that's been around for a while, but behind him is our new volunteer, like our brand new volunteer. She just like joined a couple weeks ago, and they're showing the kids how to use a triangular bandage. Even the father made a comment about, oh, I've seen triangular bandages, but I've never known how to use them. So that was really cool to see the impact that it had for those people. And then on the image on the top right, you can see that's one of our new Stop the Bleed training kits. And I was kind We used it for the bleeding control station, but also this anaphylaxis. It was used as the lay to teach people how to do an EpiPen administration. So like thinking out of the box on how we can use this equipment and sustain it over time. And then in the bottom picture, we have some of the outreach and marketing materials that we were able to get through the grants, which makes us look now more official than just a plain tablecloth, which is what I had to start off with. So. And yeah, I'm really grateful to Merkel for allowing us to get some of these strong grants so we can rebuild our MRC and continue the work, great work of these volunteers and preparedness. And that's all I got. Thank you.
Thank you so much, Katiana. I also love your enthusiasm. Being passion for this organization and for volunteer management is so helpful in getting people to feel your passion and get passionate too and excited about what you're doing. And I think it's so relevant to a lot of the units in the audience because some of you are just rebuilding your MRCs. Or you're newly transitioned to the role and you're trying to learn what you need to do. So thank you so much. Any questions for Katiana? Let me look in the chat box. Great job, Kat. Any questions for her? Okay. Well, think about it. We still have some time to go and we can always ask her later. Thank you so much, Katiana. Okay. Let me move on to Winnebago County, MRC. We have Rebecca. Oops, was there another question in the chat? Let me just see real quick. Okay. Hi, Rebecca. Rebecca Lyons has served as the Director of Public Health Emergency Preparedness with the Winnebago County Health Department for the past 5 years, including management of the Winnebago County MRC. During her tenure, she has guided both the Health Department and MRC unit through several preparedness activities and real-world responses. Rebecca holds a master's degree in public health from Emory University Rollins and has over 10 years of experience in public health. Thank you so much. That's amazing. That was the school I had wanted to go to and then changed my mind. So let me turn it over to you, Rebecca. Thank you.
Thank you. Yes. Let me share my slides with you guys. Oh, sorry, wrong button.
There we go.
You see it? Okay, awesome. So I'm doing a little bit differently than Katiana. I'm going to start with our strong grant and describe what we did for that grant, and then I'll be going into a little bit of our quality improvement project. We're looking at volunteer engagement and how we can engage volunteers during blue sky times. So first and foremost, I would like to thank Sheila Elliott, RN, who served as our MRC coordinator this past year and was really instrumental in both writing the grant and implementation of it. So shout out to her. She's still with the health department, but has gone back to nurse case management. So happy to still have her on board here and working with the MRC. I didn't do any background slides, but I'll touch on it later. So Winnebago County, for those who aren't aware, we're the 7th largest county in Illinois. We have about 280,000 residents in the county. We're also headquartered here in Rockford, which is the regional population hub for the area. We have 3 large hospital systems. So we're a bigger jurisdiction, but just to the east of Stevenson. I'm happy to have our new units come on, DeKalb and Joe Davies and Stevenson over the past couple of years. We've been a unit since 2003 consecutively, so we've gone through H1N1 all the way through COVID, MPOX, all that fun stuff. So background, why did we choose our project? I mean, I think everybody probably knows this, but 1 in 4 adults in the United States live with 1 or more disabilities in some way or the other. In many communities, and in our community specifically, seniors over 65 are one of the largest growing demographic populations in Winnebago County. So there's definitely a need there to target kind of this group. We knew from COVID-19 that this was a kind of a vulnerability area. We didn't really, understand or have the resources to assist these individuals. and it's just kind of reaffirmed over time, which I'll go into my next slide. So this is the last year of events that kind of precipitated this, and apologies that another column line. But in 2024, early in 2024, we had freezing pipes at a senior apartment building and caused flooding. Second, apologies. I just have to mute myself for 1 second. Apologies for that. Let me share am I still sharing my screen, Jeanette?
I don't see it.
Okay, apologies. I'm also an emergency response coordinator, just adjusting to that role, having both of them at the same time. Yep, we had several incidents kind of occur. This one, again, was kind of the starting one, which we only found out afterward. I started this one. There was a large fire at one of our senior living high rises, forcing evacuation of residents. The MRC did step up and assist with that, since majority of them were seniors and individuals with access and functional needs. They were displaced for 9 days at various locations throughout the county, different hotels and things like that. We assisted by making calls to both the ones that were sheltered here in Rockford, as well as those that were staying with families really across the region, some even in Wisconsin, just to ensure that they had their medical needs being met, that they, had enough medications, things like that, and were connected to their primary care providers. We also went out to one of the local hotels to assist residents in applying for SNAP reimbursement benefits. Obviously, 9 days without power, things in their refrigerator. They lost a lot of food, in addition to just being displaced from their homes and working on like emergency feeding and things like that while they were away. So this was kind of the event that was like, oh, wow. But all these incidents that occurred were all at senior and supported living is what they call most of them. They all have over 100 residents. They're all multi-level high rises. So this definitely in our community is a vulnerable group that we wanted to address and kind of help them better prepare for things like evacuations, emergencies, what's it like to shelter in place. So our project, we developed a team of MRC volunteers that can go out in the community and educate seniors, individuals with disabilities, and their caregivers and CPR, First Aid Anywhere, and naloxone training. Both Sheila and myself are American Heart Association BLS instructors, but we wanted to have a tool that our MRC volunteers could take out and use in the community. They don't require any medical background or experience to do that. We do have the regular mannequins. We did go back to these ones again, just for the kind of mobility of it and being able to take it out in the community easier than some of our mannequins. It's definitely an improvement to have 20 mannequins in here as opposed to having to lug 6 or 7 bags of mannequins. So that was definitely an asset that we got from this. We used our funds to purchase this. We also provide naloxone training. We have our drug overdose prevention program, so we are naloxone distributors, so we incorporated that training as well into it. And we also used our funding to prepare emergency kits, which we disseminated to those that participated in the training. So challenges off the bat, the grant duration being shortened. I know we extended it, but it did cause a rollout in the community and a shortening of our timeline. Again, we had trained the volunteers. We were working to train more of them, but we had to, do a rollback out quickly. So that was a limiting factor. And at this time, Sheila's also getting her MPH. She did graduate in that, so congratulations to her. But it was just, limiting factor in terms of how fast we can implement the program. And then, of course, we had one resident that had to leave. It's just generally working with this population, had a medical appointment to get to, so it was just a unique consideration that we had there. like I said, these are the benefits kind of the training that I discussed. Anyone can be an instructor. It is shorter. Typically, our CPR classes run about 3 hours. We also include naloxone in that for our staff and volunteers. But this, allowed for a shorter format. And there's no certificate fee with it, like you do have with the other programs. So it does allow us to be able to offer it. Unfortunately, both as a timing thing as well as that can be a barrier to people getting certified or for us offering the training. So that was a benefit. So we had 2 volunteers, so we were able to train in CPR and first aid anywhere. Both really enjoyed the experience and expressed interest in doing it in the future. We trained 9 residents and individuals with access and functional needs at one facility to be able to assist with emergency response. We conducted feedback surveys as part of our training, and majority of residents expressed that they felt more prepared to respond in emergency, more confidence in responding in emergency, and more likelihood to respond in emergency. So those were benefits as well. Additional highlights, we were able to leverage existing partnerships. As I explained, we worked with a facility. We did do the facility that we had worked with for the fire, and they really promoted and advertised it amongst the residents. So we did get a really good turnout for that. We also partnered with our drug overdose prevention program to be able to provide the free naloxone training and naloxone to the residents to have in case of an emergency. And we also used it as an enrollment opportunity for our access and functional needs registry or survey. So we were able to use that for there. Again, that's something more in FEP that we've been working toward, but happy to speak to that if anybody has any additional questions with regards to that. So our next steps, I'm working, as we found out through this, not all apartment buildings are required to have AEDs. So again, I'm working with looping back with the facility to kind of discuss their emergency planning activities and making sure that they have the support that they need to have the incident happen and be able to respond to it. We plan to train more volunteers to be instructors and to be able to go out in the community. And we also want to explore additional sites and groups. This could include, but are not limited to, our city and county housing authorities, which we do have existing relationships with. Other private residents for individuals with access and functional needs. I'm not sure if I mentioned it earlier, but those incidents that I highlighted above in the news clippings were all a mixture of both public housing and private. So it's a unique factor, and we want to consider that in our coverage. And we also we have an existing partnership with our Center for Independent Living, so we might leverage that to be able to train more individuals. And then we have our Lifescape AmeriCorps Seniors RSVP volunteers, which we've met with and are trying to develop a relationship with, again, to push those trainings out to the community. So that's kind of where we're at right now with the project. Any questions? Okay, I will move to my next slide deck. Thanks, Don. So increasing engagement in the Winnebago County MRC is part of our continuous quality improvement work here at the health department. We also did, I'm going to do a quick shout out, we did get our FAB recertification earlier this year. Our project for preparedness was really to focus on engaging our volunteers more during emergencies. I know from conversations I've had, it's always a question, who's going to actually show up in an emergency? We have an active pool. We don't really have definitions typically. I don't think anybody uses to define an active volunteer versus non-active. Here in Winnebago, we keep a list of individuals that can respond to emergencies. But again, we have that kind of core group, our MRC All-Stars that really, I can count on them to come out anytime. But looking at their motivating factors, looking at limitations. So we started doing that. So very preliminary, I'm just going to show you kind of our findings and how we've worked through that, and then give an update on this event that we had yesterday. So our problem opportunity statement, again, like I mentioned earlier, we've been a unit since 2003. The MRC is an asset to our community. They've assisted in multiple real-world incidents throughout the years, including H1N1, COVID-19, and Mpox. But despite this, engagement in trainings, exercises, and activities during non-emergency times and events remains relatively low. So our goal was really looking at, over the course of this year, again, we're coming up to the end of it, to increase the percentage of volunteers participating in one or more volunteer opportunities annually from 44% to a minimum of 66%. And this is a rolling number representing our volunteers at the time. We have had more volunteers onboarded through that, so it's a moving target. Just a quick sip of water. So this is we've kind of did an exercise, looked through all our documentation, we're trying to get a better idea of who are our volunteers. We have some students. Again, we are home to the Rockford campus for University of Illinois Health Sciences. So we have a med school, pharmacy school here. So a lot of these are represented in there. We have quite a big proportion of working professionals. Again, a majority of these did come on during COVID-19 and other emergency response efforts. And then retirees make up the second biggest population. But they tend to be the ones that are serving, have the most time and availability to serve. So they are the most active. And then I did do a breakdown of what percentage we do have on the high side, obviously medical volunteers there. And again, these are just the years from this past year. And then we looked at, factors. This is just us kind of brainstorming what we thought were factors for engagement and factors against engagement. We did do a deeper dive with the survey just to kind of confirm this, and it was accurate. So for students, they're eager and willing to expand their skill sets, and some of them are required to do volunteer hours as part of their education. Factors against engagement, school schedules vary. I know the med students, their school schedules change every 2 weeks, so that is a limiting factor. During non-emergency declarations, this is also a challenge that we have had. Having a MD preceptor in the field to oversee them in the administration of vaccines and things like that has been a challenge. And the short-term nature of it, it's a 4-year program. They all typically graduate and join the workforce, sometimes in the community, but sometimes, in other communities. And then they also might require more training depending on where they are in school and what they're covering. Working professionals, again, this is a large portion of our list. They tend to be a little bit less active than our other group, but they're skilled. They have experience and expertise. They're up to date or current on most of the training and practices. The biggest factor against is availability to volunteer. Can vary. Like evenings, weekends, things like that. But also we deal with the fact that when you work in healthcare all day, typically you don't necessarily want to do it on a routine basis outside of that. And they might be more resistant to change. Our retirees, again, we do have a lot of skills and experience with that. They're typically more available to volunteer. We do have, as obviously a factor against it, we do have people that, I don't call them snowbirds, but they travel out of town throughout the year, so that can be challenging. They may be more resistant to change. They might need some refresher training just to bring them up to speed with current practices. So this is just kind of a deep dive in what we were looking at for factors that affect individuals' engagement. Then we put out a survey to our 37 volunteers, and of which we had about 15 respond, which we were pretty happy with that number. So we asked some basic questions, just confirmative. Again, we have records for it and can shore that up. But most of the volunteers that participated and were most active, surprise, surprise, were our retirees. So 7 of them completed it, and we did have several working professionals. We had a couple individuals that were between work, and then we only had 1 student really participate. So it's a relatively low number. And then the other, I believe that was one of our healthcare professionals that was working in a consulting capacity. So they are working part-time. We also looked at when they last volunteered. Again, they are more likely to be engaged. So we did have about 8 of them of the 15 that were active within the past 6 months. And again, a majority had been active, but we did have people that maybe had never volunteered before. They might have started the process, been vetted, but just never actually signed up. We had one individual that wasn't exactly sure when they last volunteered, and then one person that had volunteered really during the height of COVID-19 pandemic. And then we looked at kind of on start dates. Surprise, surprise, we find that we have more of the volunteers coming on during our emergencies. So before July 2020, this was an interesting one. We did discover on there, we had we have 2 volunteers that came on really during H1N1 and have kind of stuck around or reactivated during COVID-19. And then this day was kind of arbitrary start date, but it kind of aligned with when we were kind of transitioning from using our MRC more for, testing for COVID-19, doing, case investigations and contact tracing to our mass vaccination efforts. We're doing flu vaccinations, getting ready for COVID, and then that. It's also when I started there. So that's when we pushed to having a, volunteer management program. At that time, it was time counts. Now we've switched to better impact. And our process for background checks and things like that, we use earlier funding availability for both Better Impact and Sterling volunteers for the background checks. But yeah, majority came on kind of during the mass vaccination phase, but we did have some come on here, and this kind of corresponds to when Sheila came on. Again, these are only the 15 volunteers that completed this survey, but kind of just reaffirmed kind of what we know, which is people tend to become more active during emergencies, and then maybe they fall out over time. And then we looked at motivating factors and barriers to volunteering. We did do free response because we really wanted to be able to get an idea of what it was beyond just, kind of anecdotally what we knew. So they could choose more than one response. More or less everybody chose that it was really to help their community. And then we had some individuals, that wanted to learn more about public health emergency preparedness and response. And then a couple, wanted to keep up to date on their professional certifications. It was during COVID, so we did have some individuals that was a benefiting factor is the COVID-19 immunizations. And then we looked at barriers to volunteering. We offered quite a wide variety, transportation, childcare, things like that. But these tended to be the most salient of them. So it was really timing of volunteer opportunities. Sheila and I always try to host at least one evening and weekend opportunity a quarter, ideally a month if possible. With varying degrees of success, but a majority of our opportunities are, during our routine business hours, which are 8 to 5, Monday through Friday, which can be limiting for some people, especially when you have a full-time job. And then we had opportunities do not relate to my interest areas. We wanted to look into that and see what they are interested in. I know every unit's a little bit different, and it kind of depends on the context of the community. In general, we do preparedness education and things like that, but we don't really have any hardcore medical emergency things like that. So we do have challenges with that we're working to improve. So those were the 2 big ones that we wanted to do a deeper dive into and look at more in more detail. So, and then I don't have slides on this because we just had it yesterday. We did a volunteer appreciation event last night, as well as a kind of a focus group with some of our volunteers to kind of drill down deeper and look more into it. And again, kind of the same things came up. It was timing of volunteer opportunities, but we got, again, it kind of varies from person to person, how much time they want to dedicate to volunteering, how frequently they want to volunteer. But the wide general consensus was they really wanted to help out in more outreach opportunities, specifically around mental health and just building community resiliency. So that was a big factor for that. We did anecdotally kind of improve volunteer engagement this year. And Sheila has talked about it previously, but United Way has a program called Reach Out and Read, where they provide books to primary care providers. We got books provided to our WIC department, and our volunteers come in and read. We have probably 1 or 2 volunteers coming in each week to read to the kiddos there. So we actually served about 300 kids through that program just in the past year, with about 60 hours volunteered. So that was a good benefit, but it was we got kind of a different clientele or different interest areas than some of our healthcare volunteers. But we utilize them in other ways too, like we do harm reduction programs. So, utilizing them to fill folders, things like that. We have a tire drive that we do annually. We'll try to do annually for to prevent mosquito pools and things like that. And we have volunteers that assist with that and other duties as assigned. So our volunteers really are flexible. It's just finding, what they're interested in, what they're motivated in, and connecting the two, and then having it be when they're available. So again, it's an ongoing thing, but I think we're going to be looking into some other activities. We're waiting on grant funding for some projects that we're going to be doing really around kind of more that seniors and mental health. So I anticipate doing more work around that in this upcoming year. Any questions?
Hey, Rebecca, no questions so far in the chat box. If anybody has any questions, please feel free to put them in the chat box or raise your hand and I'll call on you. Thank you so much for your project highlights. Also, the quality improvement. Oh, you took your camera off already.
Oh, sorry.
I knew you were like, as soon as I can take this off. I have a question for you. I love needs assessments because I think it's really important for you leaders to do some sort of survey, even a simple survey or an interview with your volunteers and get to know them, what does success mean to them? What are their barriers? That way you can uniquely motivate them or create activities that's going to draw them out. Was there something that really surprised you in your assessment or anything that stands out to you as that's one thing I can definitely do differently just to motivate your volunteers a little bit more or engage them a little bit more?
I think it was interesting to pull the numbers and just kind of revisit our list. And we had done that kind of a refresher when we switched over to Better Impact. I was a little bit surprised by how many working professionals that we still had that obviously came on during COVID-19 when we were kind of out of not working for a little bit.
Yeah.
But I was surprised yesterday at our engagement. So 2 of our people that came in were some of our volunteers that had been really active in the past, but it's variable. So we had a nurse practitioner and a social worker come in and contributed to that. So I was happy in that and hearing that perspective because those again are really areas where we're looking to improve and engage in those. So I guess that was kind of a surprise in a positive way, but really kind of getting back to that and doing that. But yeah, everybody was really passionate about it and really wanting to be engaged. I thought it would be more, it doesn't work in my schedule, things like that, but they were able to provide some very descriptive answers.
Awesome. Thank you, Rebecca. Thank you, Katiana. I'm going to move on to my slides. However, if there's a question that you think of that you want to ask either of our presenters, please put them in the chat box. Thank you again, Rebecca. You can take the camera off now. I know you want to. Okay, let me go ahead and share some slides. I always forget to do this, and I apologize I feel very familiar with all of you. I never introduce myself. I am Jeanette Tandez Johnson. I know some of you from previous history and then recent work with MRCIL. So I am going to provide some reminders and some updates. The first thing I'm going to go into is what everybody wants to know about. I've received some messages already asking me about this. MRCIL is intending to launch one last additional opportunity to order supplies at no cost to you This is coming from the MRC-STTRONG grant. So look for an announcement really, really soon. We were hoping to launch it this week, and I apologize we were not able to do that. We are trying to determine the actual cost of everything else so that we can determine what's left over in the grant, and then we will offer it all to you. And we want to open it to all MRC units. So this isn't going to be the first 50. I think there's 66 units right now in Illinois, so we want to offer it to all 66 and give you a sizable budget. Now, because of the timing, we're truly ending this project in a couple of months, less than a couple of months. You may only have 1 week to shop. We're going to try to give you as much time as we can because the ordering process and handling of some of the issues that come up with ordering can be lengthy. So we need to make sure we give it sufficient time before we need to start closing down the project. So if you see the announcement, please don't delay, get right on it and order your supplies so that we can fulfill it sooner than later. So as I mentioned, right now we don't have an open date and a close date. When we open it, we will let you know how much time you have, but it isn't going to be a month or even, a full 2 weeks. I don't think so. I could be wrong about that, but I'm expecting it to be more like a week, maybe a week and some days. The budget is going to be sizable. It's going to be more than the previous two. It might be around 1,800 or 2,000 for each unit. Again, this is optional, no cost to you. You just need to make sure you get permission from your agency. And we're going to offer emergency preparedness, emergency response, and marketing supplies. Now, the way we thought about emergency preparedness and response supplies the first go around, we had a lot of items, but it was limited in the way we were thinking, and we thought we were thinking out of the box. Your survey results helped us to see that, oh, yeah, these are some ideas that actually fit under that umbrella. And so I'm going to show you some of those examples. Now, all the customized items, when I say customized, meaning you want a bag and it has the MRC logo on it, that's going to take some time to fulfill. We need to hold on those orders until everybody's submitted their survey, when the survey actually closes, so that Merkle can get the best pricing for those items. And then you will be notified. So as the Amazon orders are getting ordered and shipped out, we will notify you. When the 4 imprint orders get shipped out, we will notify you as well and give you the best estimate for expectation. Thank you, Dawn. I agree. So proud of all the Illinois MRC units. Monica, do you know if there will be a strong grant for next year? Just out of curiosity. So the MRC-STTRONG grant came out of COVID-19 monies that was issued to the National MRC office. It was 100 million around 2020, perhaps 2021. 50 million of that was set aside for this MRC-STTRONG grant that was, sent or offered as a I'm trying to, not bidding, but we had to apply for the grant, and it was competitive. And I don't recall the number of states off the top of my head. I think it's over 30 that received an MRC-STTRONG grant back in 2023, June, July of 2023. So once those 50 million is gone, so I think there is an extension for some of the states till May of 2026. But once that's gone, it's gone. There's no more MRC-STTRONG grant. In terms of your funding from the National MRC office through NACCHO, which is the Aura and the RISE awards, I don't know the status of that until the federal grant, the federal budget, not grant, federal budget is signed, and then we will see what amount, if anything, is given to the MRC program. And then I will leave the national office to give you that information when it happens. I saw that there was an extension that was requested, so the government won't shut down. And so it might push it to November, but usually by the end of September, they have to sign the budget. So a little bit of background. Okay, so let me show you real quick, and I'm just doing screenshots. On the survey that you receive when it does open, this is page 1. And why am I going through detail? Because we sometimes have issues with the orders and we have to go back to you. So just to streamline everything, make sure that you do include your MRC unit number. It will be required information. If you don't know your MRC unit number, please let me know. I can help you with that, or you can go to the ASPR MRC national website. I think if you click on that you'd like to look for a local unit near you, you will be able to look up the MRC units in your state and find your MRC unit number. For the shipping address, for a few of you, you sometimes give us a street address and a PO box. Amazon does not like that. It will kick it out. So we want to make sure it comes to you. Now, we can't send it to your home. It has to be your department, your agency. But please make sure that the address you're giving us is something that typically works when you order something. So oftentimes they don't want the PO box and the street address together. That will kick it out. At the bottom of page 1, you will see this. It used to be required that you check all of the boxes. It is no longer required that you check all of the boxes. However, we definitely want you to check off the ones that you are available to accept the delivery. Now, if you have somebody in your agency that can accept it, that's perfectly fine. The reason I bring that up, if, for example, you or your agency only is open from 9 a.m. to 12 p.m., Amazon won't accept it. It has to be at least 4 hours. So for those days that you either are really not there and you want to be the one to accept it, or if your agency isn't open long enough, at least 4 hours, just don't check the box and just give us the ones that you can truly be available for that delivery. Now on to page 2. Please make sure you read these 6 instruction points. I'll go through them really quickly. The prices that's on the survey is what the price was when I researched it weeks ago. It could be different. The sale might have ended, or maybe now there's a sale, but that is the best price that we can give you. It will include an approximation of what we believe for taxes for your location. It's a general number, of course. We went with the highest amount that we could think of just to make sure it covers everything. Although MRCIL is a nonprofit, we do not have, this is another question that comes up a couple of times. We do not have a letter from the state granting us, tax-free, sales tax-free status. So we have to pay the taxes when we do the Amazon orders and any other orders. All the customized orders are going to be clearly marked as for imprint. It will be the first section of the survey. And all of those orders will either have a national MRC logo in full color or white. There's really no other color choice that worked with the product. So it's either white or full color imprint. Or it will have the words Medical Reserve Corps in one of the logo colors. So either white, black, or blue. I'll show you how to choose a quantity for those of you that are kind of new. If you need to drop off in 5 minutes, please feel free, and I will answer any questions afterwards that I didn't get to. I'll show you what it means when it says click the checkbox in the upper left-hand corner. Make sure you're looking at the auto calculation of your order, because if it goes over the budget that we allocate to you, then I have to go back to you, and it does delay in order to figure out what we can reduce a little bit. You will have an order confirmation that is emailed to you, so please keep that for your records, just so that weeks later you're wondering, what did I order and what should you be expecting? If you do want to print, I added a print button at the bottom of the page, and that will let you print your order from your survey. At the bottom of page 2, you're going to see this little widget. You can save this, and that's actually what I would suggest is you save this. It's 54 pages, and it's all the items that we have in the survey with a bit more description and a link to the product. So it's in the order of For Imprint products, Amazon products, and then the Stop the Bleed training arm. So 3 vendors. It's an alphabetical order, so it should be easy for you to find the items. And then if you want more information, please look into that. I want to be clear that these products are not endorsed by MRCIL. We researched it, but however, the onus of choosing the products that are good for your MRC are on you, and also researching it a little bit to make sure that you need it. As well, I want to remind you, if you need to get leadership permission to do this order, please do so. Again, there's no cost to you. However, you might need some space to store the product, so store your supplies. So this is a portion, this is the very bottom of the page. This is the checkbox that I'm talking about. If you only want one, you just click that checkbox and you get one of that item. If you want more than one and you toggle the quantity, it will automatically check it off so you don't have to worry. And then the auto calculation will be in the bottom. There's the print button. And when you're done, just click submit. Make sure you click submit and wait for that order confirmation to make sure that it went through. If there's any issues with the survey form, please let me know. I think you all should know at this point that there are 2 training topics that are being offered to your volunteers and to yourselves. The QPR, which we had one last night, it was fantastic. I really recommend it. It is sold out right now, but I'm in the process of discussing with the speaker. If we can get a second speaker, we might be able to open up to more seats, so stay tuned for that. The de-escalation training, there is really no max number, so we have 250 seats that I put on Eventbrite. Lots of people have registered, so thank you for disseminating that information, but we are nowhere near the max number, so please get that word out. Recording won't be available for that, unlike these monthly webinars, so please encourage your volunteers to come to those trainings. One other point that I think is important to tell you, ISC's contract with MRCIL is going to be ending November 30th. So next month, for the October 16th monthly coordinator webinar, we're going to do a closeout. I'll show you the MRC 101 for training for coordinators, as well as do a project closeout and show you all the achievements we've done in the last few years. We hope that you found that very valuable. This has truly been a one-of-a-kind opportunity that MRC here in Illinois has never had before. MRCIL would also like to combine that coordinator webinar with the MRCIL statewide meeting. So we do ask that all the units send a representative to make sure that you're hearing about any important updates from MRCIL board. So it's been my pleasure to be your project manager for this, and I look forward to the next couple of months to close out this project. Feel free to email me if you have any questions or concerns. I want to show you in live time really what the there we go. What the form is going to look like. And more importantly, I'm going to show you what are some of the goodies that are going to be offered to you that are a little different. I have 1 minute left, so I'm going to breeze through it as quickly as I can. So the first portion here are all customized orders. And we added a couple of things for your stress relief. A sun insect kit, I think that's pretty cool. These customized water bottles. And then I'm going to just scroll through for the sake of time. That you'll see that we've added more items to this that might be of interest to you. Emergency water, flashlights, ham radios, those are new. The handheld fans, those are really important. Ice packs that you can use for hot or cold. These, I know these are fun, and this was highly requested, but it's for training. So I know it's fun, but it's also for training and cuteness and your stress relief. We kept the language translator, added some basic supplies that you might need, like pens and markers and colored pens and pencils, some plushy toys for those that deal with children, responds to help them calm down, some PA systems, some shelter hygiene kits. Didn't even think about that before, but for those of you that help with homeless or human trafficking, those are perfect items. Again, another stress reliever. I will probably order this one. The emotional support nuggets. Some of you asked for safety cones. awesome. Like your suggestions were really on the mark. Walkie-talkies, water filters. These are emergency water filters, including water purification tablets, some weather radios, solar weather radios, and then last, the winter warm-up kits, a couple of choices for you. So excited. Watch out for the announcement. I will let you go. Thank you for your time and attention. Have a wonderful Thursday. And if I don't talk to you today or tomorrow, have a wonderful weekend. You're free to drop. Thank you. Thank you.